Does your patellar tendon get angry again and again, even when you've tried resting, maybe you've tried rehabbing, a bout of strength training? Well, today, let's go over plyometrics and their role and how this can be a preventative approach to developing first-time patellar tendinopathy or even recurrent patellar tendinopathy. Hi, Prehab. I'm Dorian St. Danik, Doctor of Physical Therapy, and today we're talking patellar tendinopathy. Patellar tendinopathy is an irritability and a loss of function of the patellar tendon. It's most common in activities and sports that stress the patellar tendon at high levels or high rates. So think running, jumping, basketball. It's caused by overload and overuse. So this means typically doing too much, too soon, or maybe ramping up activity intensities, durations too quickly. So with this kind of stress at the tendon, the tissue is unable to recover, it's unable to adapt. This causes collagen breakdown, which results as a loss of strength and power functionally. So if you're dealing with patellar tendinopathy, check out this video to learn what to do to address your symptoms. And if you're wanting to learn to prevent tendinopathy, go ahead and stick around. So what actually works for the prevention of this injury? There's no magic formula or even dedicated exercise routine that can prevent this injury. However, two things will decrease the risk of developing patellar tendinopathy, whether it's your first time or recurrent. Number one, managing workload. This means monitoring fatigue to identify potential overtraining. So a really simple formula we can use is the rate of perceived exertion. It's going to be a scale that we're going to figure out where you might lie on this idea of overtraining or just getting the right dosage. Okay, so let's go over this formula for monitoring our workloads. We're going to take a look at rate of perceived exertion. So RPE, it's a scale from 1 to 10, 10 being the hardest workout, the hardest type of exercise, the hardest training session you've ever gone through, versus 1 is you're just kind of resting, you're not really engaged in activity. We're gonna have duration on the other side, so we're gonna mark that in terms of minutes. So let's say I did an activity, a run maybe, that was a 5 out of 10 exertion for me, and I did that for 60 minutes. That's gonna give me a score of 300. Let's say I did a 8 out of 10 exertion run, but I only did it for 30 minutes. Well, that's gonna give me a score of 240. And if you compare the score of 300 to 240, those are within about 20% of each other. But let's say these differences in these types of sessions started to become more of a 30%, a 40%, a 50% difference. Now we might be toying around with overtraining. The sweet spot is gonna be 10 to 20% change per week. So that means if you're looking to progress either your intensity, maybe that's your speed, or you're looking to progress the duration of your activity, make sure it's falling within this 10 to 20% per week cadence. So the second effective strategy is to consistently build stability, strength, and power at the tendon. So this means that a portion of your training should include exercises that specifically load the patellar tendon. So our goal today is to offer scaled options to load the patellar tendon. We will be referencing a recent article from the Medicine and Science in Sports and Exercise Journal by Silva and colleagues, and they took a look at load indexes. And basically this was a calculation of which exercises or which activities load the patellar tendon and how much in terms of the amount of force as well as the rate of force, or kind of the tempo of the force. And they were able to create a continuum of exercises to help us choose what we might use in a rehab, a prehab, or even a performance setting when we're treating and dealing with the patellar tendon. So the goal of these sample exercises is to just give you options on where to have an entry point or start loading and how to scale up. So if the exercise you try is getting easy at around 15 repetitions or maybe 45 seconds, that's a clue that you can go ahead and progress on to the next phase. When we're dealing with pain at a tendon, we should be okay up through a mild pain, maybe a 4 out of 10. This means that we're actually going to create some adaptations and we are actually creating adequate load at the tendon. So you don't want to underload, and be okay with some mild pain that does relieve itself within 24 hours time. So let's go through some examples of what can be done to prevent patellar tendinopathy. So we'll take a look at some of these static and dynamic strength exercises. The double leg squat to 60 degrees. The double leg squat balances the load between both legs at a relatively shallow angle, which creates minimal stress at the patellar tendon. The Bulgarian squat, or the rear foot elevated split squat. This shifts the majority of the work to the front leg with a slight increase in range of motion, which is going to increase the stress at the patellar tendon. the single leg squat to 60 degrees. Single leg squat ensures full weight bearing load on one leg, and the mechanics start to create a motion that encourages a forward shin angle or a knees over toes position, and this position further increases the stress at the patellar tendon. The double leg squat to full depth. Now we're going to a full depth range of motion in the double leg stance, and this is going to increase stress on the tendon because we have an increased lengthening of the quadriceps muscle group. Getting the thighs parallel to the ground creates about 120 degrees of knee flexion, which for our purposes we will define as full range. The last one, forward lunge. The forward lunge introduces horizontal motion and momentum as the knee absorbs the impact of the ground. This increases the stress of the tendon again, requiring a little bit of reactive stability and strength to control the motion. So in summary, some of these exercises may feel easier, they may feel harder, they may be more sensitive, less sensitive. This list is simply made to be a reference point for you to try to find your entry based on your symptoms, based on your capacity. So we want to wrap up the topic with a discussion on plyometrics. Plyometrics are often overlooked in tendon rehab, and this is typically where the athlete feels really good enough to return back to their sport or their activity. But this is where most programs fail. Even if you managed your training workload, you went through a period of performing strength training, and if you haven't trained speed, power, and repetitive impact, you really haven't prepared for the demands of the sport. So if you want a framework, some education, and some progression regressions around jumping and plyometrics, our Jumping Fundamentals program in the app is a great starting point. And then our jump performance programs in the app are great progressions that are going to help you scale up to really improving speed, strength, and impact tolerance. So let's go ahead and take a look at a few plyometric progressions that ensure we develop tolerance and capacity to these higher level activities. For these, we got to keep the volume low so our intensity remains high. Remember, we're trying to develop speed and power, not aerobic conditioning or endurance. We recommend 3 to 5 sets of 4 to 6 reps, 2 days per week, and make sure you're getting adequate rest between your sets, somewhere from 2 to 3 minutes. Let's go ahead and take a look at these exercises. Okay, so first exercise is gonna be the lateral jump, the double leg lateral jump. It's kind of a broad jump, so we're going for horizontal distance, taking off on 2 legs, landing on 2 legs. Here's what it looks like. If I set up in a partial squat position, that's gonna help me wind up my motion. I release that energy and I get into a lateral jump and land. I can break these movements up or break up the repetitions to really focus on my landing and just get a feel of what's actually working. So if I'm gonna take off and jump towards my right, it's gonna be my right knee that's gonna take on a little bit more of that stress. Since we're moving laterally, the stress is actually gonna be quite a bit into our hip structures, and we're not getting as much of that forward shear stress that's actually gonna stress the knee structure. So it's a little bit more of a hip dominant type of jump than it is a knee dominant type of jump. So we like this as an introduction into plyometrics. Some progressions from this, right? I can wind up and just get into repetitive jumps, one right into the next. And then of course we do have our bounding options where we're going from one leg, landing on the other, and then finally even scaling it up to same leg takeoff, same leg landings. Some of the cues that you want to look for, make sure you're actually getting a bend in the knee, the shin is coming forward about 45 degrees, angled at the knee, angled at the hip, and you're watching for some of that alignment so that as you land, you're trying to line up your knee over your third toe, and that just ensures you're going to get good kinetic chain loading through the torso, through the hips, and really just be stable and comfortable during these lateral broad jumps. Okay, second exercise is going to be the double leg drop landing or a depth drop. We're gonna need a step, maybe something anywhere from 2 inches all the way up to 16. It kind of depends on your previous training history, your current level of tissue irritability. I've got an 8-inch step here. I'm gonna go ahead and try to come off of the step tall. This means that I wanna be extended through my hips, my knees, and ankles so that I hit the ground in a flex position, getting into a hip, knee, and ankle flex or bent position. So I go from being tall and straight down to bent in a short position. So now that we're coming forward, we have an increase at the patellar tendon. The stress is gonna be increased. It's still a double leg load, so I'm getting this even distribution of load. There's a little bit of a reactive component as the ground is coming towards my legs. And we're really gonna try to target some quadriceps loading, right? My momentum is taking me downward, and the main deceleration muscle that's gonna create zero speed for me or bring me to a complete stop is my quad. So it's very, very specific to loading patellar tendon if I'm keeping my chest up, letting my shins come forward, right? So this can be a progression from your lateral jumps. Now we're just focused on landings, some progressions. I can get into split squat landings. I can work my way up to single leg landings. All these are gonna be scaled up based on your irritability, based on your training history. All right, so let's go over our third exercise. It's going to be the double leg forward jump or the broad jump, the forward broad jump. Again, I'm gonna wind up, get into my kind of partial squat position, 45 at the knees, 45 at the hips. That's my counter movement, and then I take off and jump in a forward direction. Right now, we're increasing some of that knee load because the quads not only have to absorb my downward momentum, but they have to absorb my forward momentum. So we're getting a little bit more stress at the patellar tendon than the drop landings that we just did. There's also a reactive component, right? So we're talking about developing some speed, some agility. This is great for that because you are reacting to your landing as opposed to a little bit more of a planned landing when you're coming off of boxes. So we wind up, drop down, forward jump, chest stays high, shins come forward, angle from the side. That's a good landing. You can create some progressions for yourself by going continuous. You can go ahead and turn it into a bound, one leg to the other. You could even progress it into a forward hop, one leg takeoff, same leg landing. So for the fourth exercise, we're gonna take a look at double leg drop jumps. So again, we're coming off of a step, but instead of just sticking the landing, we're actually gonna react and take off into a counter movement jump. So as I come off, I try to spend the least amount of time I can on the ground and propel myself as vertical as I can. That ensures the quad is what's actually slowing me down and propelling me upward. Once again, some of our cues are gonna be to keep the chest high and let the shins come forward to ensure that you're actually loading your patellar tendon in your knee joint. A little bit on the landing, right? I'm probably not going into a foot flat landing because that's really gonna dampen some of my energy and some of my ability to rebound. So when you land on your toes, you're loading, but your heels are still floating, and then you're taking off for your counter movement jump, maybe going feet flat for that second landing. Some progressions, right? Maybe I can do my split stance, repetitive jumps, heavy on the front leg. Maybe I can get into drop landings off of one leg. This is tapping into one of the adaptations we discussed, that repetitive impact, right? Being reactive to the repetitive stimulus that we are definitely gonna get in our sport. So that's it. So we know this was a longer list of exercises, but hopefully it's giving you an updated menu of options that can target the patellar tendon. So we went over some static and dynamic strength exercises, squat patterns, lunge patterns, split squat patterns that give us some progressions to load the tendon when it's a little bit more sensitive. And then when we're returning to sport, we're returning to our activities, we're feeling a little bit better, we're gonna take a look at lateral jumps, which are a little bit less loading at the patellar tendon. We're gonna look at drop landings, which tend to increase some of that load. And we're gonna look at forward jumps. Now we're getting that kind of shear, or that forward momentum on the tendon. And then finally, drop jumps. This is our reactive component. This is us reacting to the ground. It's very elastic. It's very sport specific. That's kind of the top portion of loading the patellar tendon. So hopefully you have a framework to work with. Any questions or concerns, drop them in the comment box, and we'll see you next time.